So my name is Siobhán. I'm in the first year of my PhD now. So I'm split between the School of Allied Health and the Irish World Academy of Music and Dance. I graduated from the BSc in Physiotherapy here in 2023, and then I started my PhD here as well. So I suppose what originally got me interested in this project is I received a summer studentship from the Health Research Board when I was in third year of my undergraduate degree. So I had the opportunity to work as part of the research team on the Music and Movement for Health programme with Professor Amanda Clifford and Dr. Orley Green, who are my supervisors now. So this was a programme for community-dwelling older adults that incorporated music therapy, dance and physiotherapy to promote physical activity and socialisation. So I found it really interesting, and what we were noticing was some of the participants were leaving classes because they had to go collect their grandchildren, or they were asking if they could bring their grandchildren with them. So I suppose that's kind of what originally sparked the idea, is we were thinking that it would be great to have some kind of a programme where older adults and younger people could participate together. So it was quite interesting to see the differences between, I suppose, more health-focused dance interventions and more dance-focused dance interventions. And what we noticed was there was a lot of programs happening across the world in communities that were happening for intergenerational groups, but they weren't actually being researched. So while the actual research in this area is quite limited, there is a lot going on anyways. So what I want to do is fill that gap and create a program that can run and be researched so we can see what are the benefits. So previous programs that have happened, they've looked mainly at, I suppose, qualitative findings, so what the experiences were for participants, or they've looked at more like mood, wellbeing outcomes. And not a lot of studies have looked at physical outcomes, so we want to bring all of that together and see exactly what intergenerational dance programs can do for both older adults and young people. The paper has been submitted and accepted to PLOS ONE, which is a multidisciplinary journal. And I'm actually going to Italy in October to present these findings, which I'm really excited about. So it's the International Association of Dance Medicine and Science Conference, which was actually held in Limerick 2 years ago. And the talks were so interesting and helpful at that stage. So I'm really excited now to have the opportunity to actually speak at that conference. So I suppose bringing both groups together, they can learn a lot from each other, break down age-related barriers and stereotypes, because of course ageism is a big issue that affects people of all ages. And the previous studies that have happened have shown that the younger people they see older people as people, and rather than just seeing them as being older. And similarly, the older people who might have certain stereotypes in their own mind against younger people realize that everyone is just getting on together and they're kind of forming those connections in the community. So that's something that I'd really like to achieve with this project, is kind of building that intergenerational community where people can learn from each other and hopefully be more active and I suppose build their confidence to then join other programs afterwards.